There's one more question. Yes.
Thank you, ma'am. I would like to ask Mahendar, sir, are the aids, will we be aided if you want to study in UK or US, or should we have to have, money in abundance?
So the question is there any financial aid to get or pursue training in the US and UK, right? Okay. The answer is partly yes and partly no. Let me give you by example. In the UK system, how does it work? The UK system, to get through the exams, get you to the UK, apply for the programs, then stay there until you get your position. The approximate cost will run up till 3 to 4 lakhs, approximately. So if you look at it, the way I went in, I come from a very middle class family, and after I passed my PLAB, I took a loan. This is way back in '97, because I was not very comfortable starting in the UK straight away. The kind of training I had, I was from India Medical College, and where we didn't have the postgraduates, Of course, it was the third batch after the college was taken out from the donation system. So, but then we didn't have the postgraduates. I was not very comfortable taking on. And if you spoil your career early in the UK, you can't progress. So I came back to work under Professor Somaraju and Professor P.S. Reddy for 6 months. And with that salary, I went and took a loan, and it was not difficult at all. The answer is, you can take a loan here, right? And once you get into the system, it is only a 2-month salary. You can pay off the entire loan. Unlike the PG system here, you are very well paid in the PG system there. Say, for example, if you are a first-year resident in the US, it's a salary of $50,000 to $60,000. You'll easily be saving at least $1,500 per month, even if you get married. The same thing with the UK. So it is not difficult. The entire cost, if you put in, is about 3 to 5 lakhs. If it is the US system, you're looking at about 7 to 8 lakhs. But certainly you can get some funding. Then that's one part. The second part is, if you're really wanting aid, you can get to the UK. If all of you can go and check on the website, Royal College of Physicians in the UK, there is a scheme called Medical Training Initiative, MTI. Please check that, Google that. On this scheme, you don't have to do the PLAB exams. You don't have to do anything. You should just show them that you're pursuing your career. And they can pick and choose and take you to the UK on their own expense. You go into the job straight away. But for that, for you to qualify to that, you really have to perform. And what is this performance? You are pursuing your MRCP, which all the components of MRCP now can be taken from India. So you could be working in a private hospital after your MBBS, take your Part 1 and write to the Royal College of Physicians, and with the help of some of the people over here, you can be sponsored to go to the UK without any extra expense. Including your visa will be sponsored by the hospital that is going to give you the job. Now, how many can be taken in that format? Maybe a limited number, but there is a certain number where you can go to the UK without having to spend money. And even if you were to spend money, taking a bit of financial loan is not going to be a problem, because even if you can't get to the US or UK, this amount of 4 to 5 lakhs, you can repay it over the period of 5 to 7 months. I also want to give you an example of one of the students that managed to get a rank from the last batch, and he had a choice of joining a hospital in the state, and he had a choice of joining Manipal. Manipal, he had to pay 9 lakhs per annum. I've advised him to join Manipal. He raised a loan of 21 lakhs. Everybody was saying, what is this? This is stupid. But tell you what, when I was a registrar in the UK, the SHO from Manipal, I used to sleep that night. Absolutely no disturbance. That guy used to manage central lines, even temporary pacing line, he used to get the sheath in. I used to go and just put the wire. So much better training. Independently be able to intubate a patient, setting up the ventilator parameters, getting a post-procedure chest X-ray. Then he used to wake me up. That was the training he had from Manipal. And I had students from All India Institute of Medical Sciences, that was my SHO, not up to that standard. It's very surprising, the standards in Manipal, I never knew. I thought it was just a private donation college, it's not that great. But I had to change my mind once I had the students that were coming from there and we were working together, right? So my answer is, don't worry too much about your financial thing. You invest into many things, and this is your investment for your future. Don't be scared. The interest rates are very minimal, and you don't waste the money. As long as you don't waste the money, just be bold, take on the money, pursue what you want to pursue. Thank you.